I am so honored today to be interviewing Dr. William Audeh and Kelly. She is a 6-year survivor. Here at Learn, Look, Locate, we feel it's really important to have these open conversations and honest dialogue about things like aromatase inhibitors. And so, this whole interview, along with this project that I've been working on with the both of them, is dedicated to help people truly understand the ins, the outs, the ups, the downs, and the pros and cons. And so I'd like to introduce Dr. Audeh, if you wouldn't mind giving us a little background. And he is one of my amazing medical advisors, and I'm so honored to have you be part of this.
Oh, well, thank you so much for having me be part of this project. I'm a medical oncologist specialized in breast cancer. I'm the chief medical officer for Agendia, but prior to joining Agendia about 8 years ago, I was in practice for nearly 30 years in Los Angeles at the Cedars-Sinai Cancer Center, where I primarily took care of women with breast cancer. So I'm delighted to be able to participate with you and Kelly in this education program.
Thank you so much. And Kelly, real quick.
Yes, I am a 6.5 year survivor of HR positive, HER2 negative breast cancer. It was a grade 3 tumor, so it was quite aggressive, and I'm doing well today. Yeah, thanks for
That's
having
amazing.
me.
Awesome. I think it's really important that we have the open conversation. Many of us, including myself, were diagnosed with estrogen positive breast cancer. I had no idea what any of that meant. I was told after my diagnosis that because I was not in menopause, that I would be taking tamoxifen. I sat with my oncologist, learned all about the statistics, felt like a statistic, and did a lot of reading online and decided to be a little bit of a rebel. I think it's really important that people understand the pros and the cons. And Kelly is a graduate of aromatase inhibitors, and that's why we're having this conversation because she wants to be a beacon of hope, a beacon of light, and really sharing her story on how she got to the finish line with the open questions that she might even also have for Dr. Audeh. But how do patients who are hit with this tough disease handle taking these medications that, from what I've read, see so many side effects? What can you first, I'd like to level set Dr. Audeh on the pros, the cons, and the education around aromatase inhibitors. How can we help people feel confident in their choice of, I know there's different options, but and how they go about this? Because we're overwhelmed, we're reading, we're scared, and we see a lot of the cons. I'd like to open the floor up to that.
Of course. Well, every drug treatment, of course, is going to have its side effects, as well as the benefits that have made it a specific treatment for breast cancer. I think that the problem with estrogen receptor positive breast cancer is that by its very nature, it is using the estrogen hormone to stimulate its growth. So the main way that we attack that type of cancer and prevent it from coming back in a woman who's been diagnosed with it and then had it removed surgically is to prevent estrogen from stimulating the growth of those cells. So where does estrogen come from? Well, in a premenopausal woman, of course, it primarily comes from the ovaries.
Mm-hmm.
But in postmenopausal women, it comes from all over the body in small amounts. There is an enzyme that's present in virtually every tissue of the body, the breast, the skin, the muscles, the fat, the bone, called aromatase. And that produces estrogen in small amounts all over the system. So when the ovaries stop making estrogen, the only way that we can interfere with estrogen stimulating breast cancer is to stop the production. And that is the basis of aromatase inhibitors. They help a great deal, and they've prevented recurrences of breast cancer in tens of thousands of women. But estrogen is in a woman's body for a reason. It has a lot of important and beneficial effects. And when you remove it with a drug like that, there are going to be side effects that I think everyone is familiar with. a lot of musculoskeletal side effects, arthritic symptoms, as well as other menopausal type symptoms that are made worse by taking an aromatase inhibitor because the estrogen levels in menopause are already quite low, of course, and producing menopausal symptoms. But when we make them even lower with an aromatase inhibitor, it's expected that those symptoms will get worse.
Mm.
Um, in my experience, just how severe the side effects are quite variable from woman to woman. It does seem to be very much affected by a woman's own health, as well as possibly even some genetic factors that may make some women more or less susceptible to side effects. So it's a very much personalized effect that I've seen in my practice.
Because that was such a great explanation. Wasn't it, Kelly? I mean,
Oh,
I'm just
absolutely.
thank you. I mean, I'm
Yes.
just understanding it. I mean, I try to convey this out on, social media, but anyone listening, that thank you, Dr. Audeh. So with that being said, Kelly's was aggressive. You have that choice here, and you went ahead. You decided. You knew you needed to take it. How did you get through it? Because just even listening to, the explanation of the side effects, can you share with
Sure.
everyone? Yeah.
Yeah, well, my first oncologist, which I left about 6 months later, told me you'll just do a lumpectomy, tamoxifen, or radiation and tamoxifen. That's it, and was very cold about her approach. And I'm in the medical world, and I did my research, and I said, no, actually, that's not what I'm going to do. I did say I would do the tamoxifen, but I did a double mastectomy, and that eliminated me from having radiation. And it was not in the lymph nodes technically. So when I went on tamoxifen, I really had a lot of side effects, and I had a lot of joint pain, mood issues. I really was foggy. I just couldn't do it. So I went in and I said, I'm going to do an oophorectomy, which is removing my ovaries. And therefore, I can go on an aromatase inhibitor. And she said, "Oh, yeah, I guess you can do that." She just didn't really educate me. So my advice for providers out there is please provide choices and educate your patients because I know because I'm in the medical world and I did my research, but a lot of patients out there are not. And what you don't know, you don't know. So if you can just say, hey, this is not always an easy journey and there are options, we can always keep that conversation open. So I went on, an anastrozole and had some joint pain, had some fog, did all right. And at one point I said, maybe I can do better. And I changed to letrozole, did not do well. I had more joint pain on that. And that's just me. It's individual. Some people do great on tamoxifen. Some people do great on letrozole. I went back on anastrozole and have osteopenia. So I went on Zometa to strengthen my bones. And my last Zometa infusion was in June. It was not easy, but I knew that this is just temporary. And I think if you just stay in your mind that this is temporary, you're not going to be on this the rest of your life, get through it,
Mhm.
utilize your provider because they're your coach. Your medical oncologist is your coach. And I utilized my pharmacist, and they were like my cheerleader. They said, you can get through this, Kelly. It's temporary. And every time I'd fill it, my pharmacist would say, one more month, you can do this. So I think that relationship with your medical oncologist and your pharmacist is really, really important and vital to my success anyway.